Virtual pathology case walkthrough. New onset full body rash in a child. Today, we are looking at the case of a 5-year-old girl who presents to the clinic with a new onset full body itchy rash. Her parents initially treated her with a topical antibiotic cream at home, but it did not help. Just 1 week before the rash appeared, the child had a sore throat. Other than the rash, she has been healthy with no significant medical history. Her vaccinations are all up to date. On physical examination, the doctor observed numerous small red plaques covering her arms, legs, chest, abdomen, back, face, and scalp. Interestingly, the rash spared the palms of her hands and the soles of her feet. No signs of scratching or excoriation were present, which indicates that the rash wasn't caused by irritation from scratching. The medical team decided to run some tests. A rapid strep test for a streptococcal infection came back negative, but the antistreptolysin O titer was elevated at 892 international units per ml. This tells us that she had a recent streptococcal infection, which could be related to her current symptoms. With the patient's history of a sore throat, the elevated antistreptolysin O titer, and her current rash, the medical team considered several possible diagnoses. Let's go through the differential diagnosis options for a full body rash in a child. Guttate psoriasis. This is often triggered by a recent streptococcal infection and presents as small, teardrop-shaped and red papules across the body. Nummular eczema. A chronic itchy condition where round or coin-shaped plaques appear, usually on the arms and legs. Pityriasis rosea. This condition starts with a larger herald patch, followed by smaller oval patches that form a Christmas tree pattern on the trunk. Tinea corporis. A fungal infection presenting as round pink plaques with a rim of scales, usually found on the neck and back. Based on the appearance of the rash, her history of a recent streptococcal infection, and the clinical findings, the most likely diagnosis is guttate psoriasis. This type of psoriasis accounts for less than 2% of all psoriasis cases. It often follows a strep infection, as seen here, and typically affects children and young adults. Let's explore how elevated antistreptolysin O or ASO titers help identify a recent streptococcal infection. First, what is ASO? ASO or antistreptolysin O is an antibody produced by the immune system in response to a toxin called streptolysin O, which is released by group A Streptococcus bacteria. After a streptococcal infection, ASO titers rise as the immune system responds. Typically, the level begin to increase 1 to 3 weeks after infection. Elevated ASO titers help confirm a recent streptococcal infection, particularly when symptoms such as sore throat, rash, or fever are present. Streptococcus bacteria infect the throat. The body's immune system springs into action by releasing antibodies to fight the bacterial toxins. These antibodies, designed to neutralize the toxins produced by the bacteria, sometimes mistakenly target the body's own tissues, a process known as molecular mimicry. Because certain proteins in the skin resemble those of the bacteria, the immune system becomes confused and begins attacking skin cells as well, leading to conditions like guttate psoriasis, where red teardrop-shaped patches appear across the body. Thankfully, guttate psoriasis often resolves on its own within a few weeks. However, in persistent cases, sunlight exposure and topical corticosteroids can help clear the rash. If throat cultures confirm an ongoing streptococcal infection, antibiotics may also be prescribed to treat the underlying cause. In summary, guttate psoriasis can be triggered by a recent streptococcal infection and presents as small red papules. When evaluating full body rashes in children, it's essential to consider the patient's recent medical history, including any prior infections. This case highlights the importance of early recognition and appropriate management of skin conditions following the streptococcal infections. Thank you so much for watching. If you enjoyed this video, make sure to give it a thumbs up and hit that subscribe button for more amazing content. Don't forget to click the bell icon so you never miss an update. Share your thoughts in the comments below and let's keep the conversation going. I love hearing from you all. Until next time, stay curious, stay inspired, and take care. See you in the next video.